Can a lack of sleep lead to Alzheimer's? Hello, my successful and healthy earthlings. Mihaela Ragushia, a naturopath and founder of the Natural Health Podcast. And in today's episode, we are going to discuss what is Alzheimer's disease, the link between sleep and Alzheimer's, and then 3 tips to help you prevent Alzheimer's. And at the end of this episode, I'm going to give you the opportunity to join our health and success-oriented community by clicking below and joining the Natural Health newsletter. Welcome to the Natural Health Podcast, where we bring awareness of sustainable health in the business hustle space. Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve optimal health and success. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. I absolutely love, and appreciate your support. On Mondays, I'm here to provide you simple, savvy, and sustainable health hacks to optimize your health. Wow, that was a mouthful, and it always is, but I want you to know what the podcast is about for anyone that's new here, and also how to join the newsletter to get bonuses and specials sent into your inbox. And while I have you, click the bell notification button, click the subscribe button so you're notified when episodes like this come out. But if you want to know more about Alzheimer's, or if you have Alzheimer's dementia in your family and you want to prevent it, you're at the right place, because today we're going to be talking about what is Alzheimer's, right? There's so much confusing information about there, what it actually is. And some people are like, is Alzheimer's and dementia the same thing? Is dementia Alzheimer's? Well, essentially, Alzheimer's disease is the most common type of dementia. So Alzheimer's is a type of dementia. And some symptoms include a progressive, irreversible loss of memory, thinking, reasoning, and other brain functions. I don't know if you've ever been around with anyone who has Alzheimer's. They don't really remember what is happening sometimes. The best definition is, I don't know if you've seen 50 First Dates, an absolutely amazing movie that goes into detail about this disease. And for some people, it's very disheartening and sad and emotional disease to see someone go through, because essentially sometimes they don't even know who you are. So if there's something that we can do to prevent it, that's what I'm here for. I'm going to give you some simple tips to do that today. So essentially, disease progresses to later stages, affecting individuals eventually becoming unable to care for themselves independently and actually requiring caregiving, or having to be in a facility, in an aged care place, or in a facility for people who have Alzheimer's. There are 2 hallmarks of Alzheimer's disease pathology. One of the key ones that most people know about and that's spoken about is the extracellular plaque deposit of the amyloid beta peptide. The other one is the flame-shaped neurofibrillary tangles of the microtubular binding protein TAU. Essentially, we'll talk about what we're going to discuss today is mainly the amyloid beta peptides. So the reduction of deposits of these appear to play a central role in the pathogenesis of Alzheimer's disease and form the basis of the amyloid cascade hypothesis. So this is interesting to know, and I didn't go into so much detail. I mean, you can look at other videos where scientists talk about Alzheimer's disease in more depth. But here I just gave you a little bit of an insight, so then we can understand how sleep impacts Alzheimer's. And that's what we're going to talk about now, sleep and Alzheimer's. So, you know a lot of people around you that are a bit older, in the 60s, 70s, 80s, 90s, and they're napping. They're napping during the day, or they're not sleeping well. Let me tell you that is not normal. That shouldn't be just a thing as we get older. We nap more, or we don't sleep well. No, that's not a normal part of aging. And I'm here to tell you that it's not a normal part of aging. Sleep disturbances can be an early sign of neurodegenerative conditions, and they may be treatable. So changes in sleep quality and duration older are common, right? I mean, you probably know older people around you and you're like, they're either not sleeping as much, they're sleeping less, they're waking up, or they're having naps during the day. Think about your uncle at the Christmas party. He's probably asleep, right? Or your auntie. There may be a relationship between sleep issues and other symptoms of Alzheimer's. This means that sleep loss can worsen other symptoms such as delusion, restlessness, wandering, which can in turn make sleeping more difficult. So it's kind of like chicken and egg scenario. Which one came first? Was it the sleep issue or the Alzheimer's that caused the sleep issues? So essentially, what I want you to know is, in relation to sleep, getting enough sleep and spending sufficient time in deep sleep and rapid eye movement sleep, REM sleep, so deep sleep is stage 3 of NREM sleep. So That's the later stages. So you go into 1, 2, 3, and then you go REM sleep. So it's non-REM sleep 1, non-REM sleep 2, non-REM sleep 3, which is a deep sleep, and then you go into REM sleep. These last 2 stages are necessary in order to preserve memories that occur. Memory loss, as we know, is the primary symptom in people living with Alzheimer's compared to others without having Alzheimer's. Memory is the key thing that individuals lose. They lose memory. Imagine what life would be like if you lost your memory. Yeah, let's try and prevent that. So essentially, Alzheimer's patients spend progressively less time in deep sleep and REM sleep, which is quite interesting. So the last two stages of sleep, they spend less time in it. So I'm going to talk to you about 2 studies that confirm the link between sleep and Alzheimer's. Number 1 study was done by researchers at Harvard Medical School, studied more than 2,800 individuals aged 65 and over, and they examined the relationship between their self-report of sleep characteristics in 2013 and 14 and the development of dementia and or death 5 years later. Researchers found that individuals who slept fewer than 5 hours a night were twice as likely to develop dementia and twice as likely to die. That is, individuals who slept less than 5 hours a night were twice as likely to get dementia, Alzheimer's, compared to those who slept 6 to 8 hours per night. So just that extra hour, 2-3 hours. Wow. This study controlled for demographic characteristics, including age, material status, race, education, health conditions, and body weight. So that was controlled. So how many hours do you know you're sleeping, or people that you know that have Alzheimer's, how many hours are they sleeping? All right, the second study looked at research in Europe, including France, the UK, Netherlands, and Finland. They examined data from almost 8,000 participants from different studies and found that constantly sleeping 6 hours or less, so this is 6 hours, what? The first one was 5 hours, this is 6 hours or less, at age 50, 60, and 70 was associated with 30% increase in dementia risk compared to normal sleep duration of 7 hours. 7 hours, right? The mean age of dementia diagnosis was 77 years old. This study controlled for similar things as above. In addition, approximately half the participants had the sleep duration measured objectively using a wearable device. Okay, so not just a questionnaire. So this one was also using a device. So this is interesting. So this is saying that the mean age of someone getting dementia is 77 years old. And that if you sleep less than 6 hours, you have a 30% increase. So that is crazy, right? So what is new here is that inadequate sleep in midlife raises one's risk of dementia. So what we are looking at here is if you're not sleeping in midlife, right? You're probably in midlife. There are many reasons for poor sleep in midlife. Our life that we're in now at the moment, hopefully, is, kids, work, shift work, going out, partying, caretaking for individuals who may have dementia. So you may be a caretaker for someone who has dementia or Alzheimer's, and therefore you're not sleeping well, so therefore you're raising your risk of getting the disease. Anxiety, deadlines, working so hard that you're not sleeping, and therefore you may actually hit 70, 80 years old and you may not remember the work that you did because you didn't sleep well when you were in your 30s, 40s. So, for example, if you're currently only sleeping 4 to 5 hours because you're staying up late working every night, you might want to change your habits. Otherwise, your risk for developing dementia by the time you retire is high. So if you want to retire with your memory hopefully still intact and be healthy, this is definitely something to look into, is what is your sleep like? So although it's not totally understood why inadequate sleep causes dementia, raises the risk of Alzheimer's, one possible reason relates to the deposit of the Alzheimer's protein beta amyloid, which we spoke at the start. And this is why I want to talk a little bit about it, because beta amyloid is a protein that clusters and clumps together to form Alzheimer's plaques. No one's completely certain what its normal function is. So essentially it's saying that the connection between poor sleep habits and Alzheimer's is not causal. However, it does seem that molecular of heparin sulfate prostaglandins that are out of sync with circadian rhythm do not flush out enough accumulated amyloid beta plaques. So essentially, you need to sleep so your body's able to reset itself, so it's able to clean up the brain and start fresh in the morning. If you're not sleeping, your brain's not getting flushed out, you're not getting cleaned out, and therefore issues may arise. So I shared with you 2 studies. I shared with you how Alzheimer's, potential cause of Alzheimer's, and then one of the key risk factors for Alzheimer's is sleep. And I shared with you 2 shocking studies that show if you get less than 5 or less than 6 hours of sleep, that your risk of getting dementia, Alzheimer's, increases 1 double, 130%, which is a huge number. So let's look at 3 tips to prevent Alzheimer's. One thing that I want you to do is change your mindset about sleep. Sleep is not for the weak. It is for the healthy and for the people that want to live a longevity life. It is for those individuals. Number 1 is aim to sleep more than 7 hours every night. 7 hours minimum, 7, 8, depending on what you're doing that day, depending on what your routine is, how much you usually sleep, this is where you need to work with a professional to figure out what your optimal sleep is. But according to research, if you're sleeping anything less than 6 hours, there may be issues. Number 2 is consistent sleep. So not just I'm sleeping well Monday to Friday and on the weekend I party hard. It is about consistency. And the third one is quality. Make sure that when you are laying there for 7 hours, it is quality sleep and you're getting into the deep sleep and the REM sleep, which is absolutely key for memory, absolutely key for prevention of Alzheimer's. So there you have it. How key is deep sleep, REM sleep to prevent Alzheimer's? Absolutely key. Research backing it up, and I'm here to tell you that. And I'm pretty sure with the people that you know around you, you notice that their sleep may have gone downhill. People who have Alzheimer's and so forth. But if you want to prevent having Alzheimer's, these are definitely things to look into. Number 1, look into your sleep. Sleep. So ensure that you are healthy and you live a long, prosperous, healthy life. So there you have it. Do what you do best. Love, like, share the Natural Health Podcast. Hit the subscribe button. Hit the bell notification button. Join the Natural Health newsletter. All episodes, bonuses sent to you into your inbox every Friday. How special are you? I want nothing back for it. I just want to give you this amazing information so you're able to share it, because you know what? But you sharing this episode, you may save someone's life. But you sharing this episode for someone who may have a risk of potentially getting Alzheimer's, and you sharing this with them and them looking after their sleep, you have changed their life. So share this episode. There you have it. Do what you do best. Love, like, share the Natural Health Podcast. And remember, the missing link between failure and success is your health. Content and information provided here is the opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Health Podcast, Mahela Raguse, any guests or contributors to the Natural Health Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Health Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Health Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.